solves problems, and creates better opportunities for the future. I am Agren Warinda, taking you through this discussion. With me, I'm glad I visited the busiest office, and with me, I have the academic registrar of our institution. For our audience, can you please briefly introduce yourself?
Thank you very much. Agree. My name is Herbert Akugizibwe, the current college academic registrar. Really glad to have you members of the cohes times coming to visit us and appreciate the role that we do in within this institution. So it's really an interesting time and looking forward to this time.
I'm also glad to host you. With a brief overview, in 1965, it starts as a medical assistant school of training, with time a school of clinical officers, and now College of Health Sciences. Our AR today comes to tell us what are the probable programs that we could be offering in this institution at this particular time.
Thank you. As a College of Health Sciences, with the history and the background that has been stated by Agri, new programs keep on coming through.
Yes.
As this institution, it started with one program, and that was training of medical assistants.
Wow.
With time transforming until now, it's a bigger college than it was, with more than five programs that are offered. And these programs, we categorize them into three categories.
Yes.
That is the certificate programs, and we do offer a certificate in pharmacy, a certificate in medical theater techniques, and we have the diplomas, which are categorized into the basic diplomas and the post basic.
Wow.
For the basic diplomas, we have a diploma in clinical medicine and community health, and we have the diploma in pharmacy.
Wow.
Those are the programs that we have, and we have the post basic. So we have anesthesia, that's a higher diploma in anesthesia, and we have the diploma in health leadership and management.
Wow. And this drives me to the next question. What are the requirements that from your office?
The requirements will be depending on the program that they are coming in for.
Well,
you may have the requirements for the training, but you may not. That may not be the training you want.
well,
It's a professional training,
okay.
so it may not be what someone wants to become in future. So first, I would say the passion. With that, you also need to have the academic qualifications. And for those who are willing to join and at the certificate level, that is after ordinary level of education or level, at least within the science subjects, that is the physics, chemistry, biology, maths, and English, would you'd be required to have a minimum of the D. But that will be in the short term. But in the long term, the minimum would be C.
Wow.
So for now, people can take that opportunity, but in future,
There's a narrowing of space.
there will be other additions. But for now, it's just to have a minimum of a D in those principal subjects, as we call them. Now, for the basic diplomas, we're talking about the diploma in clinical medicine and community health, and the diploma in pharmacy. Those someone should have at least attained A level, that is advanced level of education in Uganda, and those should have at least scored a principal pass in biology. That is for clinical medicine. It requires the minimum of a principal pass, one principal pass in biology, with at least two subsidiaries, one in chemistry and the other in either math, physics, or food and nutrition. So with the clinical medicine, the principal subject is biology. For diploma in pharmacy,
yes,
the requirements are similar to those of clinical medicine, except this time that the principal subject, the core coding, would be chemistry. So a candidate who wishes to join us should have scored at least a minimum of a principal pass in chemistry with two subsidiary passes, and one should be in biology and the other in maths or physics to join us. But that is for the direct entrance.
Yeah.
The institution also has an entry point or avenue for those who are extensors. Those, it's about having done a medical related certificate. And those are certificate in nursing, certificate in midwifery, could be a certificate in medical lab technology, it could be a certificate in environmental health. So all those certificates that students offer after O level and they're medical related can be an entry point into the basic diplomas that we have within this institution.
When we talk of academic environment in our institution, we not only dive into the theoretical part, but also the skilling, and that is a practicability part of it. As your office, the Office of Academic Registrar, how has been the practical sessions in clinical trainings been effective, and to what extent can we judge that?
It is something that really is interesting to this within the training of allied health professionals specifically that we train in this institution. When you're doing the training during the programs you can't separate the practicals from the theories, because the products that the graduates that come out of this institution are expected to have the practical skills with them to be able to serve the different areas that they are going to work in. So in our training, we try to have a blended approach, which is a must as originating from the curriculum. We have the theories and then we have the practical. So the practical sessions we have within the hospitals, and we are glad that we have Fort Portal Regional Referral Hospital as the main training institution. We also go out to the other health facilities.
Wow.
So we are not only Fort Portal cohorts for Fort Portal, but we move to other facilities. And with that, we move to Bundibujo District, where we have the Bundibujo General Hospital, where our students are placed. We go to Chiegegwa, we go to Chienjojo, Lukunyu, we have Kivito, Karugutu, Bigodi, all those areas, Charusozi. So we expose our students to a variety, including moving to specialized units. For anesthesia students, we go to specialized units. Our pharmacy students have an opportunity to go and interface the pharmaceutical industry. So we try to give them a feel of what they are going to be expected of when they qualify. So we have that blended that has the theory and the practicals.
Wow, wow, wow. Interesting information we are getting right now, having a blend of the two, the practical and the theoretical part. As you're mentioning in your speech, we heard of the curriculum, and you know in Uganda, things move on the fast. What do you have to say about our curriculum? Who is in charge of our curriculum?
This institution is a public institution, and we run accredited programs. We're privileged that we run national curricula. And are always revised from time to time, whenever need is. And usually the standard period is 5 years, and that is meant to keep on updating.
That's very interesting. More so with the changing academic environments that we have seen technology, and here I can be specific. I've seen AI, a few that I've been able to interact with. How has this technology been important or been using as a resource to this institution as far as academics are concerned, and also the practical part of the students in health-related studies?
Albert, I thank you so much for that aspect that you're bringing on board. You talked about AI. It is everyone is thinking about AI. It is part of the. So, as an institution, when you look through the mission of this institution, technology is at the core of it. And if you decide not to move with the trends of the technology that are with us, then the students will be at this disadvantage. So, as an institution, we embrace technology, but we also go ahead and say that we need responsible use of the technology. So it is very good. I foster for the AI use, but with responsible use. So, and if we don't go ahead and embrace technology, then we shall be outdated. So it's a blended bit of it. We have the Google Classrooms, the concept that is we use the Google Classrooms,
Yes.
and that one is just increase on the times on how the interfaces of the students with the learners, the students with the teachers, and the Google Classroom is an avenue that we are really fostering for. So as an institution, we embrace technology, and we really try to avail our students with opportunities to utilize the technologies available.
I come to the next question.
Mm.
This comes after these programs are done, the basic and the post-basic. How have we, all the people that are partaking the programs here, been up to date or relevant to the current ongoing market as far as health jobs are concerned in Uganda?
Uh, the products that work out of this mighty institution, they are already having placement because we train programs which are accredited, and also we run a national curriculum. The genesis of the curriculum is from the needs which have been identified, the health gaps. So we always respond to the calls of the community. The health system tells us what we need, and we try to fit ourselves in training those that are required by the community. And our students that we train, we have to appreciate that the career path is open. It's not that after they've done a program with us, that's the ceiling of their career path. So, for example, if a student took on the diploma in clinical medicine, they have so many avenues in growing their career. We have the aspect of the clinical medicine and also the aspect of community health. So they can take on a lot of careers from there. And we are serving, when you look at the ratios of the health worker to the patient, we still are not yet there. We don't only train for government, as people are so much interested in those who are getting the government jobs. We train for the entire population, both in Uganda and outside Uganda, in the East African community, and the entire world. And there is still need for the professionals that we are producing from this institution. So we respond to what the community requires of us in training of our students.
Well, that's very good. He talks about passion and commitment first, with an academic backup. And now he tells us that we are responding to the needs of our community. Viewers watching us right now, this is not just people talking on board, but it is showing a direct environment that we are working in with as students and our tutors. Come follow us. And for my last remarks, I would like our guest today to give us a special word that will redefine us or redirect us in some.
I do thank the Cohes Times for having had this interaction, and I'm using this avenue to reach out to all those who are out there, and you wish to join us in Fort Portal College of Health Sciences, which is a center of excellence of health education and training. Please come and join us. The applications are ongoing at the moment. You can reach us physically, or you can reach us on our website of this institution so that you're able to apply to come and join us. And we are ready to give you the best of the training and the different cadres that you choose. But also, we're calling out other stakeholders who are willing to come and partner with us in this journey of training allied health professionals as we try to bring the best out of the students and produce competent allied health professionals who can be able to treat and respond to all the health needs of our community. In that, we can have a health community, a health population. And when we have a health population, we shall be able to have a productive population, and that will help us to transform Uganda into a modern, prosperous society, as stated by our Vision 2040. So I thank you and welcome you to come and partner with us in the training of allied health professionals in Uganda.
Wow, those for everyone that is watching, I remind you that we are Cohes Times and we are updating you on whatever that is within our settings, and more information is coming. Keep live, Today, we are very glad to have you as a host, Mr. Herbert, and we look to more years of bonds that we shall communicate. And whenever we call you again, we shall be very, very eager to listen from you. Thank you.
Yeah, the pleasure is all mine.